unfortunately, whether it's intentional or unintentional, some people would say either one. But the things that medicine does create fear
Yeah.
in you. Like this happens in you, and they're like, and that's what they were doing to me. They were like, you're gonna have another heart attack. Your heart's not gonna heal. You'll never do this again unless you take these 5 medications and eat this way, and it's just, and you're scared because you just had this event.
Friends, welcome to the Decentralized Health Podcast and to episode number 11. Today's guest is a very, very special human being. His name is Dr. Stephen Hussey. Stephen is a chiropractor and functional medicine practitioner, and his story of personally healing heart disease using light and environmental health strategies has become an inspiration to many and a calling for change in healthcare. In addition to chiropractic clinical practice, Dr. Hussey is a health consultant, speaker, and the author of 3 books on health: The Health Evolution, Understanding the Heart, and his most recent book, Pain Sense. Dr. Hussey guides clients from around the world back to health by using latest research and health attaining strategies. Friends, this is truly a remarkable podcast. So many things to learn here, specifically about the heart. Take notes, you're going to want to. Friends, welcome to the Decentralized Health Podcast and to Dr. Stephen Hussey. Friends, welcome to the Decentralized Health Podcast and episode number 11. Today's guest is an amazing human being that I had the privilege of meeting when I was in the El Salvador solar culture retreat, and his name is Dr. Stephen Hussey. You are going to really want to pay attention to this man's story. So, not to take up any more of your listening time, Stephen, welcome to the podcast, brother. How are you?
Doing well. Thanks for having me.
My pleasure. Thank you for, I know you're a very, very busy man, so thank you so much for giving up the time today to talk to everybody here. So for everybody that's listening, watching, that doesn't know who you are, please introduce yourself and then start your story from where you feel it's the most appropriate.
Yeah, I'm Dr. Stephen Hussey. I guess my formal training is I have a degree in chiropractic medicine, and I also have a master's in human nutrition and functional medicine. I like to say that those degrees didn't teach me much as far as what I know now. They were good baseline educations of what we think we understand, but when you dig deeper, you realize that there's more that we don't know. So, anyways, I've always been kind of a curious person, and I'll kind of start there. Like my dad was someone who always inspired us to be curious. We'd always be we'd say something, he'd be like, yeah, but why? And it'd make us think why? And when we were kids. Um, and so I think that that's why I was the way I was, because as I was getting formal training, I was always thought I was going to learn the answers. I thought I was going to when I went to chiropractic school, we learned all the basic science and all the physiology and everything. I thought, yeah, I'm going to understand why we have chronic disease. And I never really got to that understanding. And then I was like, well, the master's degree, I'll get the master's degree and that will tell me. Functional medicine, yeah, that's going to tell me. And it never really did. I mean, I learned some things and like I said, got good baseline education, but I was always more curious than that. I didn't kind of accept those as the answers. They didn't really make sense to me. And that was just me being curious. I'm not saying I'm brilliant or anything like that. It's just, I was just curious and wanted to know specifically why I had struggled with health issues most of my life. So yeah, from a very young age, I had a lot of chronic inflammatory conditions. I used to have asthma, and I used to break out in hives all over my body, just like giant hives all over my body. I had irritable bowel syndrome, terrible allergies, all these as a kid. And the best the doctors would do would be throw anti-inflammatories or prednisone or different things that would suppress these inflammatory type conditions. And my parents and I were kind of reliant on Western medicine. And then eventually at age 9, I was diagnosed with type 1 diabetes. And so I learned over the years, going to endocrinologists my entire childhood, that heavily predisposed me to heart disease, being a type 1 diabetic. And so, health has always been something that's consumed my life, but at first it wasn't like alternative health, it was just poor health. And it wasn't like I was sick and bedridden all the time. I kind of had a somewhat normal childhood, but I always had these things that I had to deal with, these inflammatory type things. And so it wasn't until college that I started to learn that I could change the way I live my life, lifestyle and have a direct impact on the conditions that I had, these inflammatory type conditions that I had. And I'm happy to say that I reversed them all, aside from the type 1 diabetes. That's kind of collateral damage, I think.
Mhm.
Although you still hold out for a cure for that some way, or my body can reverse it somehow, some way, maybe. So working on that. But yeah, all the inflammatory things went away. And at that time, I found it interesting that no doctor had ever told me that, hey, you can change your lifestyle, change your diet, change different things, and you can have an impact on these conditions. It was
Mm.
always just, well, you've got this, take this medication to make the symptom go away. And even with type 1 diabetes, it was so much easier to control when I changed my diet, and no doctor ever
Interesting.
told me that. I remember I was given a book that listed at the time, this was in the 90s, every fast food item you could get on any fast food menu anywhere, and it would tell you how many carbohydrates were in it, because that's all that mattered. If you were a
Mhm.
type 1 diabetic, you'd measure the carbohydrates, you give yourself insulin for it. There was no talk of maybe don't eat those things, or maybe eat less carbohydrates, and it's easier to control your blood sugars and that kind of stuff. So I found that interesting, and I kind of woke up a little bit in college. And at that point, it was just more just like I got interested in health. So I was always very curious, thinking about stuff, and decided to go to chiropractic school to get my doctorate. And like I said, I thought that was going to give me the answers and stuff. But at this point, I was curious enough that I was kept trying new things. This set me on this path of trying to achieve higher levels of health and understand health at a deeper level. And so yeah, after I graduated with my doctorate and my master's degrees in these health disciplines, I went to work and being a chiropractor, and always looking for new information. My first job as a chiropractor, I worked for this guy who just kept handing me books, and they were just books I'd never heard of, just craziest things. But it really opened my mind. It was really good for me, even if at the time I didn't understand what I was reading.
Mm.
So it's just always been trying to look for new information. And then I was really good at changing or controlling diet and exercise. Those were, especially as a poor student and growing up, like I could like control my diet, and I can exercise. I could do those things. Um, and then, so that's what I mainly focused on. And so especially, going low carb to help with my type 1 was really impactful. So I kind of stuck with that. And then, you know, about 4.5 years ago, I actually had a widowmaker heart attack out of the blue. I had no
Wow.
previous diagnosed heart disease. I'd never had any symptoms or anything. And I had actually had a coronary artery calcium score 6 months prior to the heart attack, and it was 0, which is a perfect score, which technically says I'm at a very low risk for a heart attack.
Yeah.
And however, 6 months later, I had a heart attack. And, I have lots of different theories as to about why that is. But at that point in my life, I was uh, obviously pretty demoralized, sitting there in the hospital. It was during COVID, so nobody could visit me.
Oh my
Um,
God.
and uh, and I was just kind of like, and just wondering what happened. So I kind of threw my hands up and I asked the doctors, like, well, what happened? And they were just like, it's like a broken record. It was cholesterol causes heart disease. Your cholesterol is too high, even though it wasn't really that high considering, which I don't think there's any such thing as high cholesterol. But yeah, that was their broken record answer. And I was just like, okay. And it was nothing else. Anytime I tried to question their answers or question their treatments, not in a negative or like aggressive way, I was just like, well, hey, what about this, what about that? There
Mm.
was just complete shutdown of conversation. Um, and so that was a problem for me. I didn't like that. And then my 3 days in the hospital, the food they gave me was absolutely terrible. It was the exact stuff that causes diabetes and heart disease, or contributes
Yeah.
to it, because I don't think diet really is the main contributor in heart disease, like people think. But yeah, someone came in and told me, this is a list of foods you're allowed to eat when you leave the hospital. And I had this big list of foods, and things that were included on there were a bunch of vegetable oils, were on there, animal crackers, fig Newtons, like those were okay to eat. That
Oh
was
my
gonna,
God.
yeah. So it was just that, and like, I was prescribed, I think, is 8 to 10 different medications while I was in the hospital, and I was told I'd be on 5 of them the rest of my life. And that didn't sit well with me either, based on previous knowledge that I knew. At this
Mm.
point, I was like, "Hey, what do you got for me?" Like, obviously, I did something, I didn't get it right. Something happened. What do you got? And and yeah, so it was just this cookie cutter approach to the care that I had. And so very quickly, I'd say over that 3 days in the hospital, I got pretty reinvigorated, with like, oh my gosh, like I started realizing that this is the wrong information. This is not backed by the research because I was familiar with the research as far as those drugs and that type of diet and things. And and so at that point, I was like, I started to realize that there's unfortunately other people are going to be in this situation too, and they're going to get this information. And I
Mm.
knew that I disagreed with lots of things Western medicine does, even though I'm very grateful for emergency medicine, obviously, in that situation. But that these people are going to be getting this information, and it's the wrong information, from my perspective and based on the literature. So
Mm.
I was like, okay, well, how are people supposed to make educated decisions about their health if they don't have all the information? And so I kind of made it my mission to share my story, but also the information that I have about heart disease. And I've looked very, very deep into heart disease, and what the actual causes are. But the things that I learned from that point, so since 4.5 years ago, because obviously the diet and exercise and toxin avoidance and things that didn't cut it. So what did I
Mm.
miss? What was going on? And I found a whole new host of information about health. And there were things that I was kind of aware of before, but I never dug in as deeply as I did afterwards because I was
Mm.
motivated to at that point. Um, because I knew about grounding and I knew about how important sunlight was, and I knew that blue light, was affecting me, but I never really completely understood it or dug deep enough to completely understand it. And that's when I started doing that, and I started realizing the impacts of those things, and so learning those things has made a huge impact, and I'll tell you what that impact was. So after the heart attack, my heart. The ejection fraction, my heart function had dropped. The ejection fraction was down to 35%, which normal
Wow.
is 50 to 70%.
Mm.
And there was damage to the tissue in between the ventricles in my heart. And so over 3 months, they told me that my heart wouldn't heal. I'd have another heart attack, if I didn't take the medications. And I did not take any of the medications aside from a blood thinner for 6 months because there was a stent in there, and I wanted to make sure that didn't cause any issues, the first 6 months.
Mm.
So, but they wanted me on a cholesterol lowering drug. They wanted me on 2 blood pressure medications and a baby aspirin as well as the blood thinner. So yeah, they said that would be my recipe the rest of the life, my life. So
Wow.
anyways, 3 months later, I went back for the echocardiogram, and my heart function had returned to normal. And the heart tissue in the septum of my heart it went from like barely conducting the signal of the heart contraction to very, very mild changes. So it had almost completely healed. I'd say 95% healed. And I haven't gotten an echocardiogram since, so I don't know. But and part of that was going to happen regardless. Your heart's going to heal a little bit. It's not like the things that I did were the only thing that, like, it's just going to happen. But at that time, they were like, "Oh, good, your heart's doing really well. You must have decided to take your medications." And I was like, "Well, I didn't actually." And so then, uh, about six, or I guess maybe a month after that, I started being more active again, and trying to get back to activity. And so I started walking and trying to run and stuff, and tried to play soccer a few times. And I couldn't. My lower right leg from the knee down was incredibly painful if I started to run, or even walk fast through the airport, or something like that. Like I couldn't do it, and I didn't know what it was. I was like, "Is this like compartment syndrome? Is it like a deep vein thrombosis? What's going on?" And eventually got around to getting it diagnosed, and it was I developed plaque in the femoral artery in my leg that was restricting blood flow to my lower leg. And the morning I had the heart attack, which I think was the straw that broke the camel's back, I did a very intense workout where I would sprint up a hill, drop and do push-ups, do lunges to failure, that type of stuff. And my leg was fine, during that time. So something between that morning I had the heart attack and now had changed. And the only thing I can think of is when they placed the stent, they went through the femoral artery in my leg.
Ah,
And so they went through up like that to place the stent.
yep.
And so downstream, the blood flow was changed, and that created this situation of plaque, which is not, it's not completely unheard of. It's rare, but it happens. And I couldn't get the vascular surgeons to admit that that was the case, because I was like, my leg was normal. It's not normal. It's the same leg that the heart cath was done on. Like it has
Just
to be
makes
something,
sense.
right? And so, anyways, that device is still in there, but so I finally got around. There was a 75 to 99% blockage of plaque in that, in my femoral artery, my distal femoral artery. And so at the time they were like, well, it's not really interfering with your day-to-day life. It's just you can't do some activities you like to do. So like, we're just going to leave it alone, because when we start messing with them, they get worse. That's what they said. And I said, okay. When I mean mess with them, they like me put stents in and do bypasses around it. And they said, when we do that, it usually gets worse. So I said, okay. And so I had been doing some of my routine that I was doing already since the heart attack. And that included infrared sauna. It included more sunlight. It included grounding and setting my circadian rhythm. Those are the first times in my life that I really prioritized those things.
Hmm.
And then there's other things that stayed the same. My low carb diet stayed the same, which means that my LDL was quote unquote elevated.
Mhm.
Like at times my LDL was like 400, which they would say is going to kill me tomorrow. Anyways, my stress got probably worse at times after the heart attack because of personal situations. And so, but through that time, the things that I did change were kind of the more light and more quantum things that I
Hmm.
changed. And I also took a supplement called serapeptase for 1 year.
Great
Um,
product.
yeah, after I got the peripheral artery disease diagnosis in my leg, but I only did it for a year. But a year after the initial diagnosis, I went back and got a follow-up scan, and the plaque had dropped to 50% narrowed. And at the time, like, the technician did the test, she left the room, came back in, and said, the doctor wants me to do the test again. He saw something he doesn't usually see. So what she said, she did the whole test again, and it was the same. So it had gotten better. And at that time, the vascular surgeon said, well, we can't say it's better because we don't see these things get better, especially in type 1 diabetics. Like,
Hmm.
typically type 1 diabetics fare worse than type 2 diabetics in peripheral artery disease, which is what this is. So anyways, another year goes by. And the second year, I didn't take serapeptase. I was just doing the quantum stuff and just made that my lifestyle, just made it what I did. And always learning more and more aspects of it, getting deeper and deeper into it. And over the next year, I went back and got another test, and it was completely normal. And then a year after that, I got another test, and it was still normal. And I can run now. I can exercise with no pain in my leg. So I completely
Incredible.
reversed that plaque, which they told me was impossible. And that second follow up that was normal, the guy was like, "Well, I guess you don't have to come anymore." But there was no like, well, "What did you do?"
Yeah.
Like, what is there anything different? Like, like, why wouldn't you be curious about that? Because that could potentially, you just accept that this is a disease we can't fix.
Yeah.
When maybe it is in some people, because I can't say that my example would be like that for everybody, but maybe it is something we can fix in a lot of people and help them. Why wouldn't you
Hmm.
be curious about that? So yeah, so the results I've gotten have really inspired me to really talk about this, and really help people. And then back in February, just a few months ago, I went and I got a CT angiogram of my coronary arteries, and I got they analyzed by a Clearly company, which is like an AI. They kind of take that information and they make these nice images of it.
That's
Uh,
cool.
and my arteries, the stent is open, it's patent, like there's nothing, there's no plaque there. There's a very mild amount of plaque in my right coronary artery, which was there at the time of the heart attack, so that has not progressed, and the rest of my arteries are clean. So everything is nice and clean, even with the stent in there, which, because the stent can interrupt blood flow and that can create some changes. Um, but yeah, so it's been maybe 6 years of having these high LDL levels. And, during that time, I had a heart attack, and people would say, oh, see, that's your LDL levels. But at the time of the heart attack, they weren't that high. They were a little
Hmm.
bit elevated, but now they are, because I've gone very low carb, and that's a phenomenon that we tend to see. Um, And throughout that time, not only did I not develop plaque, but I reversed plaque in my leg with LDL levels astronomically high, like they say, which again, I don't think we should be calling any cholesterol level high or low.
No.
It's just what it is at the time. But yeah, so that's kind of my story. That's what's led me to here. So now I'm, uh, looking at all aspects of it. I have no filter. Any information about health, I want to learn it because
Yep.
you can't write anything off, and it's working for me. So it's kind of inspiring, and I just want to share that with people.
Wow. Okay. One, that's incredible. Two, well done, because that's, again, I'm kind of speechless with that. Like I knew your story because I've heard it before from a different podcast, but hearing you say it, and obviously having met you and seeing how healthy you are in person, yeah, it's just incredible. Like, it's very rare that I'm speechless in these substances, and it's a very personal story for me because, as I said to you one before we started recording, my dad has had 2 heart attacks. He's got 9 stents. He went in for a bypass and ended up having to have open heart surgery. So this, other than I wanted to hear your amazing story, this is obviously like another reason why I wanted you on here, because I want him to listen to this, because there are things that he's being told that he has to do. And again, like the wording they used with you is, you will have to be on these things for the rest of your life. Like, this is all very affirmative talk, which is not what you want to be telling somebody. You want to be giving them hope that there's a potentiality that they don't have to be. Obviously, you're very strong in mind. So the second that they're saying all this stuff to you, in your head, you're probably going, nope, nope, nope. Where other people would go, okay, and they'd accept it. And then all of a sudden, as we know, our thoughts do create things, and it does shape our world. And so if you start believing it, it's going to come into reality. So I want to backtrack a little bit, because there's some really amazing parts of your story that I want to kind of uncover a little bit more. So you had all these health issues when you were a kid, and when you got to college, you were able to reverse them, heal them. And that in itself is an incredible story. But you also did that as a type 1 diabetic, which makes it even more remarkable because of the complications that can come from there being type 1. So unpack what you did in those scenarios to kind of get to that point where those health issues that you had when you were a kid just disappeared.
Yeah, I mean, it was very basic stuff, like easy stuff in college. Like I majored in health and wellness in college. That was so I had all these health and wellness classes. So I was learning about health from, a very standardized, public education type thing, point of view. So again, I would consider that very basic today, but it was basically just eat better,
Yeah.
like eat better foods, exercise, that kind of stuff, like talking about social relationships. And when you're in college, like at least when I was in college, I was just like, let's just pass the classes, and get on with things. Um, I never really found a passion at that point until the end of college, when maybe my junior year, end of my junior year, I started to get really passionate about health and wellness. At first, it was just like, well, this is cool. I can change my lifestyle, and these things go away. So at that time, like, um, you know, I guess in high school, if I would exercise, like I would play soccer, played soccer in high school, and there were times when I would still have asthma issues. And I definitely had them really bad when I was a kid,
Mm.
even in through middle school, but it kind of got a little better, but there were still times when I would have those. And then once I got to college and started just eating whole foods, basically, even at the school cafeteria, which is, not going to be the best, but I would just choose better options and not the processed foods. Then I had, like, asthma was no longer there. Um, I stopped. I stopped breaking out in hives all over my body. When I was a kid, it was really bad. It was literally hives, like huge hives, just on my body. It's a big red welt, at times. And so, and that kind of got a little bit better too, but it was always still there. And then I changed the lifestyle, and it stopped. It went away. And like at that time, like I said, it was really just getting rid of these inflammatory foods that I
Mm.
was told was okay, and not eating those anymore. Um, so yeah, I mean, and the IBS stuff, like that got significantly better when I changed my diet too, but that was still hanging around. Like it was still an issue. Like I still had GI symptoms, even in chiropractic school. And the only thing that fixed that, the thing that finally fixed that, was when I went carnivore, which was well before the heart attack. It was just an experiment I did, and it fixed the gut issues. And then even when I introduced plants back into the diet, I was still fine. So it was almost like my gut just needed this reset.
Yep.
And I don't think that plant toxins cause gut issues. I think they perpetuate them if the gut issues are there. They
Yep.
make them worse if you've already had some injury or something that's there. So, and then, so it's kind of hard to say an exact timeline, but of when these things are. But then, like, the best I've ever felt is when I set my circadian rhythm. And the longer I've done that, the better I've felt,
Yep.
because you really see the real benefits the longer you do that. But yeah, so it was just like these things where they just improved. Even if they were still around a little bit, they would just improve. And that kind of gets you like, oh, well, that was interesting. What if I did? Then it makes you curious, like, well, what else could I do to make
Yep.
it maybe go away? And it just starts you on that path to trying to figure that out. And gets you obsessed with trying to figure that out, like of
Yep.
trying to be healthy. And then you learn about all the things that in our modern world that are creating poor health or contributing to poor health. And you start to get a little obsessed with it. And so, yeah. And then one day here you are. But even then, like those experiences back then, just learning that I could change the way I live my life, and have an effect on these things really impacted me when I did have the heart attack, because I knew, I was empowered at that point enough to say that there's got to be a different way. What did I miss? There's got to be more. So then I would investigate further. But you're right when you were saying that, like, what happens? Like, people have this experience, and unfortunately, whether it's intentional or unintentional, some people would say either one. But the things that medicine does create fear
Yep.
in you. Like, this happens in you, and they're like, and that's what they were doing to me. They're like, you're gonna have another heart attack. Your heart's not gonna heal. You'll never do this again unless you take these 5 medications and eat this way. And it's just, and you're scared because you just had this event, or you just get this diagnosis of something, which is a test or something. And that fear shuts down your decision making. It shuts down
Yep.
your processing. So when that happens, people are just like, okay, yeah, I'll do that. I have to now because this happened. I tried to prevent it before, and that's, to me, at least for my situation, that was not the truth.
Yep.
And I had to overcome those thoughts and those feelings and things like that. But I understood that I had a medical background. I could look into this a bit more. So that's why I want to share it, so people can figure that out. Have this, like, I'll have that experience for you so that you don't have to.
Yeah, no, I agree with you. And I think we're saying these things to people when they're in an already compromised position, where when you get a diagnosis or when something traumatic happens, and then you're in that state of, what you need is support, what you need is reassurance, what you need is safety. That's what the body's screaming for at that moment, is safety and stability. To then come in with these very negative, again, deliberate or not, statements, particularly when it's that white lab coat syndrome, right? That, as we're saying again before we start recording, that authority figure, well, they clearly must know because they're an authority. Well, it then goes back down to the known knowns, the known unknowns, and the unknown unknowns. They only know what they know. And all we've got to do is go way back in medicine, where they used to never wash their hands, going from a cadaver to a childbirth, and then wondering why babies and mothers were dying. And then some guy said, maybe we should wash our hands, and they ridiculed him.
Yeah, they're
And then
like,
they
no, get out of
realized,
here.
right, you're a crazy man, go and sit in the corner. And then they realized, actually, no, maybe we probably should. So they only know what they know. And this is no disrespect to them in any way, shape, or form, because doctors get to a point where they can't, I guess they haven't got the time to learn anymore, because they're always on call, they're always doing something. So they don't have that time, and they don't have a lot of time with a patient either. I mean, in the UK, they get like 9 minutes. That's not a long time. So, they have to say what they have to say, but at the same time, it needs to be more reaffirming rather than shocking and fear inducing, because that again puts you into a vibrational state, which is not a good place to be. And as we know, as we said, thoughts create things. So it's important that the right things are said at the right time to empower people to say, okay, it could be like this, but it could also be like that. It could get better. They don't have to prescribe anything. They haven't got to say, oh, go and do quantum. They could just say, oh, there is a chance 50-50. it could go this or that way. It all comes down
Yeah.
to your decisions and the lifestyle that you choose.
Yeah.
So before we get into the quantum, because that's the bit I want to unpack the most, I'm curious. You're studying health and wellness and all things basically exercise and nutrition at this point. What was the spark that made you go chiropractic? What made you want to go down that route?
Wasn't anything inspirational. It was just basically, so I really got passionate about health and wellness, like I said, at the end of my junior year in college, because I met a girl and she was
Ah,
passionate about health and wellness.
there we
And
go.
so we kind of discovered this kind of passion that we had together. And she her plans were to apply to naturopathic medicine school. And so she applied to the school out in Oregon and she got in and I was like, well, I want to stay with this girl. So I found there was a chiropractic school in Oregon. And so I applied to that school and I got in. And so off we went. And that relationship didn't work out after a few months, maybe 6 months in Oregon. But that's what it was. Like that's just being honest. There was no, and I'd always been to chiropractors. My parents took me to chiropractors as a kid, so I was familiar with it. My parents told me that it used to help me with my asthma. I don't remember that. They just told me that they noticed the difference when I was young. So that was always interesting to me.
Mhm.
And I thought like, yeah, some medical professional degree, that'd be a good move. Sure. Let's do that. And I didn't find out about, what chiropractic is, in anything until I was in the school, and learning about it. But even then I didn't learn that there was such a big divide in chiropractic as far as like my school's on one end of the spectrum. The one I went to was very evidence-based. They're preaching just what the research shows, very diagnostic. They want to train us to be primary care physicians, and that kind of stuff. Whereas there's another side of chiropractic, like down the other spectrum, there's just like, it's very philosophical. It's very, spine in line, everything's fine. Like you affect the nervous system, you're going to do everything. And so I've been on this side of like not seeing, I didn't get a very philosophical basis for chiropractic in school. And it actually wasn't until the quantum stuff, I started learning the quantum stuff, that I was like, oh, you can't explain chiropractic without knowing this quantum stuff. That's why
Yeah.
medicine doesn't understand chiropractic, because they're trying to explain it biochemically,
Yeah.
and that's not how you explain chiropractic from my perspective. Now I've given lectures at chiropractic conferences about the biophysics of chiropractic, not the technique biophysics. That's a very different thing, but the actual quantum aspects of chiropractic and how, to me, it explains how it actually works.
Mm.
It's not just this effect on the nervous system like chiropractors think. It's not like we're freeing up nerves to communicate. That's not what's happening, in my opinion. So yeah, it's kind of been a long journey with chiropractic. But when I learned this stuff, like the quantum stuff, it opens your mind to all kinds of things. And so now it's like, I do like chiropractic more because I understand it from that perspective.
Yeah.
Whereas before I was just like, I don't know if I'm doing anything like adjusting the spine and just freeing up the nervous system. But then I understand what I'm actually doing. It's like, oh, I am doing a lot of good for this person. I understand why. And then I wrote a whole book about it. So yeah.
Amazing. So before we get onto the quantum, you then studied, you got your master's in functional medicine.
Mhm.
So very, as you say, very rudimentary based, evidence based chiropractic. Functional medicine, not so much. A little bit more, I guess, in the alternative realm, holistic realm, even though it's still medicine. What made you decide to add that on and do that side of things?
Mainly because I like learning what I learned in chiropractic school was great. It was fine. Like, and we learned like in chiropractic school, like in Oregon, in Portland, Oregon, where I went to school, there was an oriental medicine school, a medical school, a chiropractic school, and a naturopathic school. And
Okay.
so we used to get like the four major disciplines in medicine were there. And we used to have these meetups with other students, like they called them SAIN, like Student Alliance for Integrative Medicine. So we'd all get together and talk to the students from different schools, which was fun. And we all basically learned that we're all learning the first 2 years, we're all learning the exact same things. We all learned all the anatomy, physiology, histology, pathology. We're learning all the same stuff.
Yeah.
And then after that, it varies, right? And
Mhm.
so I thought, like I'm going to learn this stuff. I'm going to understand why I was sick as a kid, all this stuff. And it never happened. Like I learned like what we think we understand about physiology and how to diagnose. And and refer people out to different things and figure out what's going wrong with them and all the stuff that you learn to be a doctor. But it didn't really tell me like, why did I get sick then? I know how to
Mm,
diagnose what I had, but I didn't tell me why. You
mm,
know, I had that. Like if you break out in hives, you call those hives. You know, urticaria, whatever it is. And so then I was like, okay, well, maybe this functional medicine, that sounds it. Yeah, like they're looking deeper. They say they find the underlying cause. Yeah, that's what I want. You know, so my school had just started a master's program a year prior to me graduating chiropractic school in human nutrition and functional medicine. So I said, yep, let's do it. So I did it, and same kind of thing. You know, learn a bunch of stuff. You learn a lot of like underlying I guess you learn more about like the environmental factors. They talked a lot more about toxin exposures and mitochondria and different reasons underlying dysfunctions that are
yep,
happening in the body and how to approach those. But it didn't tell me why. Like it didn't
yep,
tell me why are those dysfunctions happening. Just like basically, unfortunately, in my opinion, functional medicine has become the same model as Western medicine. They just use supplements rather than medications. You
yep,
know, take a bunch of blood work. They say, "Oh yeah, look at all this stuff. I may understand a little bit more about why it's happening for you. Take these supplements." You know, because that's profitable. You can do
yep,
that. And so I don't agree with that approach. I want to change the environment of somebody and actually make their physiology express itself differently. That's not disease. And sometimes functional medicine may be a little bit closer to that, but it's still not what we want it to be. But
yep.
that was the stimulus there. And then I guess at that point, I got that degree and it didn't give me the answer. So I was like, all right, I'm done with degrees. Um, what are we gonna do now? You know, I got to figure this out.
All right. Now we can go into the really exciting stuff. So, how did you and when did you first discover the more decentralized quantum circadian approach to all of this?
um, uh, well, it's been different at different times. So before my heart attack, I knew about Dr. Tom Cowan and
Mm,
him talking about, you know, Rudolf Steiner and all these people in the past who, you know, the heart is not the main mover of the blood. I
yep.
say it that way because I think the heart is a pump. It's just not a pressure propulsion pump like we think it is. And it's not what mainly moves the blood. But so I knew about that stuff and I knew about Gerald Pollack and structured water. I read his book and I knew that that lined the arteries and I knew some of the effects. I've gone way deeper now. So I was aware of that sort of stuff. And I hadn't put it together in quite in the way that I have now. But yeah, and then so after the heart attack, that's when I was really motivated. I was like, okay, something something's up. Something happened and I can't explain it, therefore I need more information.
Mm,
And I started using an infrared sauna because I was aware at the time of the robust amount of research that shows that infrared sauna is amazing for heart failure patients. And in the hospital, that's all they kept telling me was that you have damage to your heart now. You're at much higher risk for heart failure. And I was like, I do not want heart failure. And they said the best way to stop that from happening is take these blood pressure medications, take pressure off the heart. But I knew that the sauna would be huge for that because there's tons of research, mainly out of Japan, that shows that. So I got a sauna and I started using it. I didn't realize other benefits of infrared light and endothelial health and all this other stuff until later. That's why I
mm,
originally started doing it. And I understood that stuff later. So that was a very infrared quantum thing, like this light aspect of things. Um, and then it probably wasn't until I got the peripheral artery disease diagnosis in my leg that I really started doing the circadian rhythm stuff. The first 6 months after the heart attack, I was really just using the sauna and taking some supplements. Like I took Wabaine and I took Strophant or serapeptase and a few amino acids that help build nitric
mm,
oxide and stuff, but I don't think those were the main players. Um, so so yeah, and then it just kind of slowly evolved. And then I came across uh, Gilbert Lang's book because Pollock talks about Gilbert Lang, so I started
yeah.
reading Gilbert Lang, and then I got into a bunch of different quantum books and things. And then I came across Carrie Bennett,
Yep.
and so she uh, uh, led me in a lot of different directions. And so I started getting more quantum books. and just reading and reading and reading. I like to go straight to the source. I don't
Yep.
like, I mean, I like learning people in presentations too, but when they mention a book in the presentation, I want the book
Yep.
and I want to go read that.
Yep.
So, and then that book leads me to other books. And then I read this book that was edited by Fritz Albert Popp that is basically just like biophysics, this huge book. It's like this thick. And it was just all of his summary is biophysics. And so I read through that whole thing, and that led me to all these different resources. And so, yeah, it's just been this journey that just keeps unfolding. And that's how I really got into the quantum stuff. It was already kind of there, but I just didn't look deeper until I was motivated to.
Yep. We need that motivation to do. I think that when the pain, what do they say? When the pain of staying the same is greater than the pain of change, that's when you're motivated to do what you need to do, right? So I think that's it's a running theme through a lot of the people that I interview on here, and the conversations that I have on other podcasts as well, is the fact that, and you'll probably find this with clients as well, they come to you when they're ready for that change, when they're just they're no longer comfortable being uncomfortable. They are now uncomfortable being uncomfortable, and the change needs to happen. But while I remember, I'm going to have to find the name of that book you just mentioned, because I want to read that. Instantly. Oh, amazing.
Right here.
Okay, Intricate Biophysics. All right, I'm buying that. I'll be buying that after this. I'll be reading that one. I'm like you. I love. Listen, I've got a lot of courses. I've got your courses. I've got Carrie Bennett's courses. I've got her practitioner one. Sarah Pugh. All these lovely people. And I love learning from them because it helps, as you say, just assimilate the information in a different way. I can listen to it while I'm walking. If I'm in the gym, whatever, if I'm driving, I can listen to everything. But I love a book. I've got loads of books, and I just love doing that because then I can understand it in my way. And I take from the book what I need to take at that time. And I don't know if you do this as well, but I'll read a book, think I've taken from it what I need. I then may revisit that book because I'm trying to remember something that it said. And then I'll find something else that I completely missed. And I'll be like, oh, how did I miss that? That's exactly what I need to hear. That's brilliant. All right, cool. I'm going to use that. So I always like keeping them because I will revisit them at some point. And anyway, not about me reading books. So you said something quite fascinating, which was the quantum changed the way that you looked at your chiropractic work and how you now lecture on this specific thing. I would love to know more about that. So obviously, I don't need you to lecture me because I know you've got a lot going on and you haven't got a lot of time. But what changed with your views on chiropractic work once you understood the quantum and biophysics side of things?
Yeah, I mean, the traditional like theory of chiropractic, like even like D.D. Palmer, who was like quote unquote inventor of chiropractic, even though people were doing adjustments well before D.D. Palmer came along, like ancient societies were doing adjustments of things. He coined this profession of chiropractic. Anyways, he was called a magnetic. That's what he was, but he wasn't using magnets. He was using, I guess they were calling magnetic because it was like the energy transfer between things. And then, they were manipulating the spine, the joints in the spine, which they were like, well, how is this having the effect that we're seeing in people? Because they couldn't explain it at that time. And we don't really see those effects today because back then in 1895, there were much less environmental things causing poor health than there were then. There were still some, but not as much. And so they were seeing these interesting things by adjusting people's spines, these kind of healing stories and everything. And so, anyways, they were trying to explain that, I guess medicine or different, even like different chiropractors or different physical medicine type practitioners were trying to explain this, and they were doing it from a very anatomical perspective. Like, we're adjusting the spine. What is that affecting? We're creating joint motion. Oh, the nervous system's right there. The spinal cord is right there. We must be affecting signals from the nervous system. And we probably are. But to me, that never really felt like why we're seeing the things we're seeing in chiropractic. Like there's the theories that, we're changing the way the nervous system is expressing itself or signaling, like the stress versus non-stress signals, sympathetic versus parasympathetic, and vagal tone and all that stuff. There's those ideas, and that may be how we're doing it, but I think we're doing it from a more quantum aspect. And this is something that I outlined in my book Pain Sense. But what I've learned because it's fascinating to me. Like I'll have an idea and be like, I wonder what happens with an adjustment. And then I'll go into the research and look at it. And somebody's looked at it. I was like, do we emit light? Do we emit sound? Obviously we emit sound with an adjustment. Do we emit electromagnetic fields? And I'll look at it and it's like, yes, somebody's looked at that and we do. Interesting. Who knew that research was out there? And so I started looking at that stuff and I started learning about fascia
Mhm.
and I started learning more about fascia. Sorry, Alfred's in the way here. Uh, but started learning more about that and how the fascia is this communication system and how it
Yep.
conducts electrons, protons, all kinds of information, and how it goes all the way to into the cells, into the nucleus. And I was just kind of put that all together, and then I also knew a lot about coherence and heart coherence, because that's what I was looked at it for my book and everything as far as the heart disease. And so I put all that kind of stuff together and I realized how we're seeing like the changes that we see in people lots of times, not all the time, but lots of times with chiropractic. We're seeing
Mm.
them, not just their health improve, we're also seeing their demeanors improve. Like I've talked to many chiropractors. I asked them this when I'm on stage, and I said, "How many times have we seen someone come in who's kind of disgruntled? They don't think this is going to work. They don't really want to be there, whatever, and they reluctantly start, getting chiropractic care, and over time they become like one of our best patients. And it's not just because we fix their problem, like their pain problem, like that wasn't even their biggest issue, really. But they just became a nicer person. And to me, we're creating more coherence.
Yep.
And the reason that we're doing that is because when you adjust the spine, yes, you may relieve pressure on the nerve, and that may help the nerve conduct, but coherence is not determined by how the nervous system is signaling to the body. Coherence is determined by your environment. And this means external environment and internal environment. And your heart is what's measuring coherence because it has the biggest electromagnetic field of any organ in the body, because it's vortexing, because it's spiraling, which amplifies its field and makes it the biggest field. And so the heart's picking up on our internal and external coherence. So external coherence could be disrupted by a toxic relationship or electromagnetic fields or artificial light disrupted circadian rhythm, all those things. And then internal coherence can be disrupted by a stored past trauma or scar tissue in fascia or low or poor mitochondrial health. So the mitochondria aren't communicating from cell to cell, or just low body charge in general, where we're not conducting signals very well through fascia, or low structured water, because structured water is kind of like the thing that surrounds the fascia and helps the signals conduct. So all those things can interfere with how well your body is synced up and communicating with itself. And when your cells can't communicate with themselves and the body's not on the same page, it gives the heart picks up this incoherent signal, just like all the things externally, like the toxic relationship or the EMF, the artificial light, somewhat interfere with our ability to connect to our environment, to the ether, to other living things. And if that stuff's happening, then the heart's also picking up a very kind of distressed, incoherent signal. And then that signal is then relayed to the brain electromagnetically, wirelessly, and also neurologically to the brain. And people like to think the brain is in control, but the brain is not in control. It is more like the post office. It's just receiving messages. It sees what it says and it sends it where it needs to go. It doesn't change the message. It doesn't tell your
Yep.
body anything different. The messages come from our senses, and we think there's five senses, but there's more than five senses. The heart's picking up coherence is one of those senses. And so our emotional state can change this. All these things can change this. And heart rate variability is, I guess, the number one way we measure that coherence. And so we also know there's a robust amount of research that when you adjust the spine with chiropractic, you restore structure and function to the spine, we get increases in heart rate variability. And to me, we're doing that because when we adjust the spine, we're removing interference, and
Mhm.
they think it's interference from the nervous system. Like chiropractic philosophy says nervous system. I say we're increasing communication, because when you adjust the spine, I found literature that shows that we emit light, non-visible forms of light, which melanin could be doing something with and creating energy for the spinal cord through the water in the spinal cord. We emit sound. Obviously, people hear a sound when you get
Yep.
adjusted. We emit an electromagnetic field. And we also have this piezoelectric effect that's created that creates electrons and sends those electrons through the fascia. So basically, when we're adjusting the spine, we're saying communicate, communicate. We're also breaking up scar tissue in the spinal area, but there are other forms of body work therapies that will also be good at breaking up scar tissue. And I think that all forms of body work therapies and physical therapies will do this to an extent.
Mhm.
Chiropractic's just the best at doing it in the spine. And so when you're doing that, you're increasing the internal communication in the body. And then the heart's receiving a more coherent signal that's being sent to the brain, and the brain relays that information to the body, which is changing your autonomic nervous system expression. But it's also creating a more coherent person. And a more coherent person is better able to reach out and interact with their environment in a more positive way. And Merle McCready has talked a lot about this coherence, and how society is suffering from incoherence. To me, that's how chiropractic it works. And because we also know that heart rate variability is associated with or poor heart rate variability is associated with every chronic disease out there.
Yep.
So, that's why it's having an effect. Although I am not of the mentality that chiropractic will fix everything, which lots of chiropractors say, just adjust the spine. And it's like, no, there's so many more aspects of our life and our physiology and our environments we need to change in addition to that. And I think to get over most issues. But yeah, that's what I came to with chiropractic. And it helped me understand it from that perspective. So now it's like, it kind of gave me my faith in chiropractic back, because I was kind of getting burned out, which is like, oh, we're just adjusting the spine, affecting the nervous system. That doesn't make sense to me. But you understand it this way, and I'm like, oh, that makes way more sense to me.
Yeah. Gives you more meaning into what you're doing.
Yeah.
Yeah, 100%. So you said two very interesting things there. First one, you mentioned coherence, and the second one was the fact that the heart vortexes. So before we get into the heart vortexing, because I think that's a very important piece for people, because obviously I know coherence obviously through the quantum side of things, but I found coherence when my body came down with an autoimmune condition, and I used heart math as one of those ways to return coherence into the system. So for people that aren't familiar with heart brain coherence, in a less quantum, slightly more lay person's way, how would you explain the importance or what coherence within the body is?
So yeah, I mean, I guess the simplest way to put it is when, like, internal coherence is when all aspects of our physiology are synced up and communicating so that they can do what's best for the system as a whole, um, rather than act individually what's best for this cell versus this cell. So it's like we're part of a collective.
Yeah.
So we need to do what's best. So it's just like, it'd be like a company of 50 workers. And let's say each worker, let's say they were paid based on commission, and so it was very competitive. They're all looking out for themselves, right? Whereas if everybody bonused when the company itself does better as a whole, they're all encouraged to work together to make the company higher, so they all benefit. So coherence would be everybody communicating on the same page, having the same goals. And we want our cells to be that way. When we get pathologies or dysfunction, like mitochondrial dysfunction or low body charge or whatever it may be, the cells have trouble communicating, even to a cell that's right next to it. It kind of senses that it's not there. And so if that's the case, then it's going to act more selfishly, which at the end of the line of acting selfishly, that's a cancer cell. But so coherence, that your body, like the heart, I would say, is the only organ that has an electromagnetic field large enough that it can, like, it's big enough that it can sense every cell in the body. So it's the main one that's measuring coherence, and all the other organs have an electromagnetic field, but this is kind of like the one that syncs everything up. And so when it's kind of getting a sense, um, it's kind of measuring how well the body is synced up and communicating. And so if we have all these kinds of things that are interfering with our body's our cellular communication internally, then the heart's getting a very distressed like signal.
Yep.
And that distressed signal is affecting the signal that's being sent to the brain from the heart. So, but the more important thing to understand about coherence is that people say, well, how do I improve that? And it's all about the environment. So if you want your body to express more coherence, you need to put it in an environment of things that make it feel safe, and not distressed. Because I mean, we've said it before, like when you feel distressed or you're in fear or whatever, then you shut down decision making, and you know you're much more likely to cause other issues. Like you express yourself in a negative way,
Yeah.
and so the heart's going to feel the same way. If your circadian rhythm is disrupted, you're surrounded by EMF, you have a bunch of toxic relationships, you're eating toxic food, you're not in touch with the earth, all that stuff. Your heart's kind of like receiving all these signals of like, oh, I don't know where we are, and it's kind of like stressful for it. And that's going to be reflected in your heart rate variability and be sent to your brain. And the brain's like, oh, we're in this bad environment. And it sends a more stress signal back down to the body. And then that puts us, in a state where it's harder to do certain things like
Yeah.
digest or sleep or whatever. And so, but if you want to change that signaling, you have to change your environment. You can't take a pill. Like people take like these adaptogenic herbs and things like that, thinking they're going to calm their stresses. And I'm just like, yeah, it may help a little bit. Maybe it'll have a transient response, but if you really want to change, you got to change your environment.
Yeah.
That's the same mentality as Western medicine. Don't figure out why it's there. Just give yourself this pill and hide the symptom.
Yeah.
So to me, supplements are really no better unless you're doing the other things. If you do the other things, they could be really helpful, but you got to change the environment. So that's what coherence is to me. But the most important part of that is that if you want to create coherence, you have to change the environment. It's
Yeah.
not something you can just, because even then, like people will do these things like, like a face cold plunge, and yes, that will be great for training your nervous system, and it will, or they'll like hum or do all these different things, all these different, or breath work, like that is all really great. And yes, it has been shown to like improve heart rate variability, but you've also got to change the things that are causing the disturbance. It's like we can't just keep putting out the fires with these various techniques and not catch the arsonist.
I like
So
that analogy. That's very
yeah,
good.
yeah.
Yeah. Yeah.
So yeah,
That's joy. It's such a beautiful explanation of what coherence is, particularly when you, please everybody go back and listen to that again. And when you're listening to that, understand that if the environment outside of you is a stressful environment, it is going to cause a lack of coherence internally, because the heart, from my understanding, creates this toroidal field around us, which expands out past our body. It's picking up on those signals, and it's then relaying those signals of either stress or safety to the rest of the body, to the brain, which then will adjust that level of coherence within the body. So please listen to that bit again, because it's very important, because you can't get healthy in an environment that made you sick. So
yes.
sometimes you do have to, say sometimes, a lot of the time, you have to change the environment. And if you can't change the environment because you can't move or whatever the case may be, what are some of the things that you can do to mitigate, offset the stresses within that environment? If it's a toxic relationship, leave. You're not a tree, as Jim Rohn would say. You're not a tree, you can leave. So these are some things that you can do. Now, heart as a vortex. I'm very cautious we're running low on time, but the heart as a vortex. Explain that to everybody, because this is beautiful.
Yeah. Well, so when you look at the anatomy of the heart, there's this guy named Francisco Torrent-Quasp, who's a Spanish researcher, and he found that the heart is actually one big band of muscle that is kind of wrapped up on itself. So so it's like linear, but it's just wrapped up. And so when the heart sends an electrical signal, or when the brain sends an electrical signal to contract, it's coming through like in a spiral like nature. And so like the contraction happens like this. It's more like it's rotating like an American football when you throw it rather than a basketball. And so the heart, that's one way that the vortex happens. But also the job of the heart is to vortex blood. And that has to do with building, energizing water so that it can become structured water. But it does that in many different ways too. So, when blood flows into the heart, it's kind of like when you drop a quarter in one of those things and it goes like this and it goes all the way around, like the blood flows into it and it spirals when it gets into it because of the way the heart is shaped. But also when it comes past the valves, it'll eddy on either side. Or when it leaves the valves, or when it flows into the veins that come to the heart, they kind of the two veins, the vena cava, come back, and they kind of create a vortex here. And that's necessary. We need that interruption of blood flow, that turbulence in blood flow during that time, because water going through linear tubes gets dead. It doesn't, it kind of gets incoherent. Like the water molecules aren't interacting the way that they should anymore. They call it dead water. And so the heart is there, placed in the middle of our two arterial systems, our venous and arterial systems, so that it creates this vortex thing that can happen. And then the contraction of it is also the vortex as well. And so what gives things their electromagnetic field is mainly mitochondria. Mitochondria are giving this electromagnetic field, and when you concentrate mitochondria into something, then you get a bigger electromagnetic field. And so if you look at the organs that have the highest concentration of mitochondria, it's the brain, the heart, and the eyes. And the eyes are smaller organs, so it's not going to be as big of a field, but the brain's even a little bit bigger than the heart. So why is the heart's electromagnetic field bigger than the brain's? And it's because it's spiraling. And there's evidence that when you create a spiral or a vortex in an electromagnetic field, it amplifies the field. And so I have never seen any research on this, but I would love for someone to look at. Maybe McCrady's done it in heart math, but like I know they looked at like heart rate variability in heart failure people, but in heart failure, when the hearts become more like a basketball and it's not spiraling very well anymore, like is the electromagnetic field smaller? I really wondered if they looked at that. But anyways, so the vortex is really, really important. Now, it's a chicken or the egg thing, but I've also found things that show that vortexing, the spiraling, is what creates an electromagnetic field. But I've also seen things that electromagnetic field is what creates a vortex. So I don't know which one. Maybe but they're very tied to each other.
Yeah.
So if you get a lot of non-native electromagnetic fields around you, that could interfere with the ability of the heart to vortex. But that's this idea that the heart is a vortex, but it operates more like a hydraulic ram. But when you just look at it, what it's doing, it's spiraling in nature. And when you look at what happens to blood when it comes into the heart, it creates vortices in the fluid. And that's its job. It's one of its jobs, is to vortex the blood. Another job is to create the electromagnetic field and measure coherence. And then the other one is to maintain the pressure between the two systems, because if we didn't have a heart there in the middle of between the veins and the arteries, then during exertion, all the blood would rush over to the arterial side and we would die because the venous side would collapse, because there's so much tissue demand for oxygen and nutrients in blood. And so if the heart wasn't there to actually slow the flow of blood, there's very elegant research that's done that shows that during exertion, the heart slows the flow of blood. And if it wasn't there, then we'd get this imbalance between the pressure in the venous and the arterial side, and we would die because the pressure would collapse. And there's fascinating science done back in the 1800s, of scientists who just could not build a system that mimicked the heart with a pressure propulsion pump. They had to use other sorts of things. They couldn't mimic it. So yeah, that's the idea of the heart as a vortex.
Wow. I understood it, but it's just games. It's a game. When you hear stuff like that, nature doesn't make mistakes, does it? Like it generally knows what to do. So it then begs the question then, and this is something I was just thinking when you're explaining that. So if you have something like what my dad did, where he had open heart surgery, and they're obviously taking the heart out and then putting it back in. And this is just my question here, just from this. How does that, and I'm sure nobody's done any studies on this either, how does that impact the vortice? How does it impact the electromagnetic charge? Like, I'm sure it must impact it in some way. It must do.
For sure. I mean, I don't know all the specifics of like those types of surgeries. Like, do they put it in exactly the same way it was? I don't know. Have they changed the tissue? Have they changed the conductive signal of it? I don't know. But another interesting thing that's relevant here is that I think the heart is also the sensor of our emotional state, and certain aspects of our personality I think their personality is probably little bits of it is put in all organs, but especially the heart. That's why we say things like "I love you with all my heart,"
Yeah.
not "I love you with my mind" or my spleen or something like that. Or, um, you know, I mean, I don't. Maybe if you really like somebody, you love them with your spleen too. But yeah, we attach this emotion to this organ,
Yeah.
and there's actually really interesting research where they've looked at people who heart transplants, and they actually take on characteristics of the person whose heart they received.
Yes, I've heard
Um,
this.
yeah, so like they did interviews where they would interview the people in the donor's life, interview people in the recipient's life, and the recipient themselves, and they found that anywhere between 2 to 6 different personality changes happen in the donor or in the recipient that mimic the donors. Like they all of a sudden they start liking French fries, or they like this type of music. They got into it, and it turns out the donor liked that type of music.
Yeah.
So there's information stored in here
Yeah.
in the heart, and I think in all organs, but specifically emotional personality wise,
Yeah.
from the heart. And when we put it into somebody else, so how does taking it out of somebody and doing something to it and putting your own heart back in you? I don't know how that would change you. But it's to me, it's kind of a shortcoming of a philosophy of Western medicine, in that they think we can control this. We get like nature got it wrong, we have to get it
Yeah.
right, kind of
Yeah.
thing. And the biggest evidence that nature got it right, um, and I'm not saying there's no place for Western medicine, but the biggest evidence that nature got it right is like, what is water doing on the earth? It's always moving.
Mhm.
It's flowing in rivers. It's going through ocean currents. It's crashing on the beach. Like the water is being turbulent. It's just being mixed up, and it's evaporated, precipitated. It's being moved, and there's no like laminar tubes that it's in. It's
No.
it's just being swished around, and so in order for us to take the ocean with us, when we came out of the ocean, we had to put some ocean water in us, and that is the blood. The blood is the same salinity of ocean.
Yeah.
And so we had this water. Now we had to transport it around. We had to do it in this tube, but that doesn't work because the laminar tubes create dead water. So what do we need? We needed a heart to go and vortex the blood as it moves through us to maintain
Wow.
energy. And that's what nature provided for us. That's what we needed. And if something dysfunctions, like if the heart starts to dysfunction, it can't do that as well, we will experience poor health, which I would say is heart failure.
Yeah.
But it's not the heart that's failing most of the time. It's the mitochondria in the heart that's failing, or it's the lack of infrared light and structured water in the body that's causing the heart to be more of a pump than it's supposed to be. So yeah, I could go on and on, but
Dude, I've never heard that reasoning before, of that we had to take the ocean with us as our blood. Like that's mind blowing. That's absolutely. I've never thought of it that way before, but it just makes
mhm,
perfect sense.
mhm,
Coming from the sea to the land, we had to take the ocean with us.
mhm.
That's such a beautiful way of putting it. I love that. I love that. All right, that's a perfect place to end this bit. But before I let you go, where can people find you? Talk about your books. Like, what can people learn about? I'm going to put everything in the show notes anyway. But where can people find you? Your books, courses, all that type of stuff. Because I know you've got something really cool that you're working on as well. So
Yeah.
please let people know.
Yeah, my website is resourceyourhealth.com. Like find new sources of health kind of thing. And so my books are on there, which I've written 3 books. The most recent one is about pain, and then there's the heart book, and then there's one called The Health Evolution. And and then my you can contact me on the website. Recommended products are on there. My blog's on there, but I rarely write on my blog. I'm much more active on social media. My social media is just Dr. Stephen Hussey, Dr. Stephen Hussey. You can reach out there. And my courses are on my website too. And then yes, I am working on a program for people that's mainly giving them peace of mind. Like it's teaching them this philosophy of health so that they can be free from the shackles of like, oh, you have a high CAC score, oh, you have high cholesterol, oh, you had a heart attack, like, and the fear, like we've talked about, like the fear that's created with that, and then the fear that medicine puts in you, like, because that's what I had to do. I had to figure that stuff out for myself. And when I learned this information, it freed me from being scared of those things. So I'm trying to develop a program that's hopefully going to be out very soon, that people can, get into and learn from and everything. Yeah, I don't know what I'm going to call it yet, but it's coming.
Amazing. Well, Stephen, thank you so much for your time, for sharing your story, for just showing up as your amazing, beautiful self, and just letting the world know who you are, and all the lives that you've impacted up until this point, and however many thousands, hundreds of thousands of lives you're going to impact from this point on. Ladies and gentlemen, if there's anything in this podcast that has hit home or has made you think of someone else, please share this with them. It's such important information. And share, subscribe, reach out to Stephen, connect with him, read his books. His books are incredible. I've just bought the Heart book for my dad as well. So yeah, please reach out to him and support his work and follow him on all his social media platforms. And until the next time, stay blessed, stay well, and we'll see you guys soon.